I'm Judy Zelina. This is the Millcreek Government Channel. Pennsylvania offers a free health insurance counseling program known as Apprise that is designed to help older Pennsylvanians with Medicare. Counselors are specially trained staff and volunteers who can answer your questions about Medicare and provide you with objective, easy to understand information about Medicare, Medicare supplemental insurance, Medicaid, and long-term care insurance. Joining us on the program today is Benny Mitchell. Benny is an Apprise counselor with GCAC. Benny, thank you so much for joining us on the program and actually letting our viewers know what Apprise is all about.
Sure, Judy. Glad to be here.
First off, what I do want to tell, what Apprise is all about. What is Apprise?
Well, the Apprise is a free health insurance counseling program for folks who are on Medicare beneficiaries. Helps them navigate the process of Medicare, whether it means to enroll into Medicare, making Medicare plan changes, anything that has to do with Medicare, we can assist folks in that matter. Actually, the program is in all 50 states. It's actually called SHIP in the other 49 states. That means State Health Insurance Program, but it's called Apprise in Pennsylvania because there's another program that uses the same acronym as SHIP in our state. So we go by Apprise. Just simply means to be apprised of your Medicare options and the Medicare concerns that folks have in our area.
I didn't know that. It's SHIP in every other state.
Yes.
Huh? Mm-hmm. Interesting.
Yes.
Interesting. Who would be eligible for Apprise counseling?
Well, traditionally, a lot of folks think it's for senior citizens age 65 and older who are on Medicare, which is correct. However, there are several folks in our community that are under 65 who have certain disabilities, deemed by the Social Security Administration, and those folks have Medicare as well. So anyone who has Medicare, whether you're 65 or older, or whether you're under 65 and have certain disabilities, if you're on Medicare, you qualify for our program and to get help with our services. We also assist some folks who are on Medicaid as well.
Okay.
Because there are folks who are on Medicare and Medicaid because, based on their income.
Right.
And some folks are just on Medicaid simply by themselves. We can assist those folks on a limited capacity, but if we can't help them any further, we have people that we can reach out to help them as well. So we're on Medicare and Medicaid.
This is a great program. Benny, what was the initial reason for creating this Apprise program here?
Well, I'm sure you've heard it several times, Judy, that Medicare is so confusing. It's very, I mean, I'll just say it like that. It's very confusing. It can be very complicated. And if people don't enroll in a timely fashion, there are so many deadlines and timetables and penalties that they can occur. And these are lifetime penalties that these folks can get if they don't enroll in a timely fashion. They don't pick the right plan. It can cost them their health if they don't have insurance, if they can't access their medications. It can cost them their money while them paying higher premiums for their Medicare Parts B and D. So it's very important that people enroll into Medicare when they're eligible, when it's time for them, because it can cost their health and also cost them more money in the future. So the idea was to put someone in place in our states to help these folks navigate the process, help them understand Medicare and understand when to enroll, how to enroll, and how to go about getting things done. So that's why the program was created.
Because you're right. People were probably missing these deadlines and getting penalties, not even realizing that this was going to happen because it was so confusing to do this.
Exactly. I get phone calls all the time. People just saying, I just don't know what to do.
Right.
I don't know how to get help. And that's why we have this program in place to help those people understand what's going on and tell them what's next, where to go next, and how to get involved in Medicare and navigate that system.
Well, we're going to be talking about some of the different programs, but the one thing I do want to touch base with, any of these programs, is there cost involved?
No, our services are absolutely free.
We like free.
Yeah. Like I said, Apprise is in all 50 states, and this is funded by the Pennsylvania Department of Aging, so it's free for a free service There is no charge. We give, unbiased information. We don't pick one plan over another. We look at the individual and see, based on what they're telling us, their needs are,
right,
and their health is. Each plan is very individualized. So what's good for you may not be good for your neighbor or even your spouse. It really depends on your health and your condition and your financial situation, things like that. They're all factors.
Take all those factors into consideration.
Exactly. Look at the whole picture of what's going on with that individual and try to help them come up with the best choice decision for them. We give them some options and say, based on what you're telling me, these are the plans that look good for you, and then you can pick one of these plans and see which one will work for you. So,
Ben, do you just work with Erie County? You personally, GCAC here?
Right, GCAC's in Erie County, right,
okay.
Yes.
All right. Now, where can I find my local Apprise counselor? Is it just down at your main location?
Well, actually, no. We're in 8 locations. We're at the main office, where I am on 18 West 9th Street there. We have 2 stations in the city, because all of our GCAC operated senior centers are all certified Apprise counselors, okay? So we have one at 823 Peach downtown, which is our Benjamin Wiley Senior Center. And we have the Erie West Senior Center over on 8th and Cranberry Street. We also have one in Northeast, Union City, Corey, Albion, and Fairview. So we're spread out throughout the county to help folks access those that help if they're in their own backyard.
That's nice. That's nice that they don't have to go downtown, because in some of those rural areas, it's not easy for them sometimes to get down to the main office.
Exactly. You know how the parking can be sometimes downtown, so it's kind of tough. So we just
not that easy.
We just kind of intake them and see where they live, and if you live in those outlying areas, we refer them to that closest site to them, so they can get help in their area. So not too far of a drive to get to.
Okay, Benny, are there programs that can help Medicare beneficiaries save money on Medicare costs?
Well, actually, there are. There's a couple programs. One I would mention is called the Medicare Savings Program, and that's ran through the Department of Welfare, where it helps you pay your Part B premium.
All right.
Okay, and that one's administered through them. Another program is called the Extra Help Program, and it's ran through the Social Security Administration, and that helps pay your Part D premium and also lower your medication copays as well. So they could go as low as $1.20 a month for a generic medication, depending on your income.
Right.
Those programs are very vital and help folks access their medications. It lowers their out-of-pocket premium costs and helps them save some money on Medicare. Again,
though, you would be able to look at their financial situation and help with the paperwork.
Right.
Because that's where I think everybody right away gets frightened. When they see all the paperwork, they're afraid they're going to fill something out wrong.
Exactly. We have folks who come in, and you may tell them, what they need to do,
right,
but then sometimes they won't follow through with it because they, like you said, they just are intimidated by the paperwork. So we can actually apply for them at these offices. We can do the application with them for both of those programs, so they can ensure that it went through the proper way. And we screen each client. We see it when we come in.
Okay.
When they come in, we ask them what their monthly income is,
right,
and see what they're all eligible for. So we all do that every time we meet a client.
Benny, when you're looking at some of their financials and their needs, do you work at all with PACE or PACE-Net?
Absolutely.
If you see they're eligible and signed up?
Yes.
Tell our viewers just briefly, a little bit about a PACE and PACE-Net.
PACE and PACE-Net is also help with prescription drug coverage. Its program is ran by Pennsylvania residents only. You have to be age 65 and older to be on PACE or PACE-Net. And it also offers, helps pay your Part D premium. Will also lower your co-pays on medications. The PACE program it's $6 for generic and $9 for a brand name. And the PACE-Net program is $8 for a generic and $15 for a brand name medication. And there is no donut hole when you're on that program as well. So it helps folks access their medications at a cheaper cost and all year round. So those are benefit.
And I think it's very important that you talked about that, because we sort of work with it, but we don't realize how many people are not even aware that that's out there. You brought up a term when you were just talking that many people are not aware of, the donut hole.
Exactly.
The infamous donut hole. What is that, Benny?
Well, the donut hole is actually a coverage gap you reach once you reach the max out-of-pocket cost that the plan will pay for your medications in a calendar year. Like all Part D plans have a coverage limit what they'll pay for medications. And I believe for next year it's $3,700. Once you reach that threshold, you go into a coverage gap called the donut hole, in which you're responsible of 100% of the cost while you're in that area until you reach a catastrophic level. At the current time, due to the Affordable Care Act, that donut hole is slowly closing some. It's helping out. If you're in the donut hole, you pay 51% of generic medications in that area, and you pay 60% of brand name drugs when you're in that coverage gap. And still, even though that's helping out some, but that's still a lot of money you have to pay when you're in the donut hole.
That is.
I mean, half of $500, just $250 just for one medication. And we have individuals who are on 10, 12, 15 different medications. So that really can be taxing for someone who's on a lot of medications. And sometimes it may only be 2 or 3 medications that they're on, but the one they're on is maybe a new medication. There isn't a generic available yet, and it's very expensive. So we always tell them to, consult your doctor and let him know that you have this issue and see if he can, help you out some kind of way. But we do have folks who fall in that coverage gap, and the PACE and PACE-NET program has also helped with that. And also the Extra Help program through the Social Security Administration. There's no donut hole if you qualify for the Extra Help program as well. They get their medications all year round at a reduced cost, and it's a very big benefit for folks who are in that area.
So you would probably recommend if someone is not eligible for PACE or PACE-NET or the special Extra Help, that when they're looking for a Part D prescription plan, and they're taking a lot of prescriptions, because they do have plans that do have a donut hole, but they also have plans that do not have a donut hole, and it covers everything, correct?
That's not correct. They all have that.
They all do?
They all have that gap. They all have a max what they'll pay for their medications for the year. Now,
did that change? Did there used to be?
No,
they always have that donut hole.
They've always had the donut hole. No matter what plan you choose, they have a donut hole in them. It's always important, though, that you make sure that the most expensive medication you take are covered in that formulary. So make sure that all your drugs you're taking are covered under that plan's formulary before you want to enroll into that plan. So if you don't know, you can come see us, of course, or you could simply call your plan and ask them, is this medication going to be covered under under the formulary? But yet they all have that area where they will pay a max amount of money for medications.
So this is why I need you on the show. I don't know everything. I really don't. Formulary. What is? Can you explain what that is to our viewers?
Well, medications are based on like tiers. There's like tier 1, tier 2, tier 3, tier 4. Some of the medications that are been around for some time, or like generics, or maybe like a tier 1 level, where there may be a cheaper co-payment for you out of pocket.
Okay.
And then the tier 2, maybe like a more expensive medication, the co-pay may go up, and some maybe tier 3 may have to get a prior authorization from their doctor to send to the plan to allow that prescription to be covered as well. So there's a step therapy the way they do. I mean, there's a lot that goes on into the medication, field that we've heard and seen throughout the years. So make sure that the drug that you take though is on your plan formulary to make sure that you're in the right plan for you.
Okay. All right. Now, Apprise, can you provide counseling and help someone who is just going to be turning 65 and ready to retire? Because, of course, that's me, and I'm going to tell you, my mailbox has 3 trees in there every day. I open it on different insurance plans, and it's getting late. You got to do this, you got to do that. I work a little bit with this, and it's overwhelming.
Right.
So can I bring all this to you and say, help me sort this out. Here are my needs. What should I do?
I get that all the time. I get a phone call and say, Benny, I have all these, flyers and brochures and mail people are telling me I need to enroll in their plan, and time is running out, and the deadline's approaching, and it kind of scares people a little bit.
The sky's falling.
They don't know what to do.
Yes.
Exactly. So I know what you're talking about. So what happens is some folks are enrolled automatically into Medicare. Those are the folks who are usually already collecting Social Security benefits. It happens automatically for them.
All right. If I say, for instance, I was on disability. Okay.
Automatically. For folks who are just working though and are not, they have to go out and actually sign up. Okay, and you're eligible to sign up 3 months before your 65th birthday, the month of your birthday, and 3 months after your 65th birthday. So those are the times to enroll into Medicare.
Okay.
The sooner, the better. If you enroll early, it'll start on the first day of the month you turn 65. If you delay it and sign up after your birthday, you may delay coverage to up to 3 months after you enroll. So it's important to avoid the gaps in your health plan through your employer. So when you retire, most folks lose their employer coverage.
Right.
Don't have anything at all. Then they want to roll right into Medicare, so they're covered for the following month. They can get their medications for the following month. So there's no issues in that. So we ask folks about 4 or 5 months before your birthday, come give us a call or come in and see us. Or if you're someone who's going to work past 65, be like 4 or 5 months before you actually retire for good.
Okay.
And you're going to lose your employer coverage, to reach out to us and contact us so we could help those folks make a good enrollment decision.
All right. Okay, Benny, what's the most popular question? What do you hear most from people that are new to Medicare?
The most popular question I hear is folks telling me, like, what should I do? What plan should I choose? What's
Do it for
what's
me.
the
Pick
best
it
coverage?
for me,
right. They say, if I was your mother, Benny, which plan would you put me in? I get that question a lot too. So
yeah, Benny, if I was your mother, what plan would you put me in?
And so we give them, we just tell them, we explain it to them how it works. We tell them the different ways to access Medicare, with whether it's Part A and B, then paying the out-of-pocket cost by themselves at 20%, or whether it's an A and B in an Advantage plan, or it's an A and B in a supplemental plan. We just kind of break it down to them, so they explain to them how they all work and what is best for them. Tell them based on their health, like I say, based on what they can afford to pay, and based on what their needs are. So it's all very individualized. We kind of bring them in and explain it to them first.
Okay, so you just brought up a couple things, and I get confused on these myself. The difference between a Medicare Advantage plan and a Medicare Supplement plan. What's the difference?
I get that question too. A lot of folks get confused. They say they want a supplemental plan, but it actually may be an Advantage plan. There's a difference between the two. And the difference is, in Advantage plans, they're usually regional plans, so they cover like the area you live in. So maybe it may cover here, sometimes maybe in Ohio, sometimes it may be in New York. It depends on the region your plan is in and where you live, okay? And then they have, in those plans, you have to have Part A and B to buy them. And those plans normally, not always, have a Part D drug plan attached to it.
Oh, all right, okay.
So it's all rolled into one.
Okay.
And then there's the Medicare to Medigap plan, which is a supplemental plan.
All right.
Now that plan is a national plan. It goes with you from state to state, no matter where you go. It covers a lot of the co-insurances as well. So what you have is you have Part A, which is hospital, Part B, which is medical for your doctor's appointments.
Right.
Then you have that 20% you have to pay out of pocket. And if you have the right GAP plan, supplement, it'll pay that 20% cost for you. And then you have to get a Part D plan because the GAP plans don't have a drug plan attached to it. So there's 3 premiums involved: the Part B premium, the Medigap plan premium, and then the Part D drug plan premium.
So it might get
it can be costly. Right. Now, they ask me, what's the best coverage? What's the best coverage? And I just tell them, it really depends on your health and what you can afford to pay. But I give them the true fact is, if you can afford to do it that way with the A and B and the supplement and the D, if you can afford the premiums, that offers the most coverage.
It covers everything.
Right. If you're in the right plan.
Right. You're right. And there are many different
There
plans.
are many different GAP plans as well.
This is where you come in, Benny. I wanted to talk a little bit about now Apprise counselors. Are they all volunteers?
Actually, like I said, staff at the senior centers, they're all staff for GCAC, the directors there. And we have about 3 volunteers right now, 2 or 3. We're looking for more volunteers actually to get involved in the program and to help us enroll folks, help us do data entry, things like that. So we're always looking for volunteers to help out. But it's for staff and volunteers. It's a volunteer model-based program. So we look for volunteers to help and train.
Okay.
We have training programs that we put them through. So we're always looking to get some.
That's what I wanted
volunteers
to ask.
involved.
How can I become a volunteer?
Well, you should contact the main office at GCAC and ask to speak to myself or Kim Malone, which is the program director for the Center Services
All
program.
right. Okay.
And then there's an application that you can complete, and we review that application, and then we would call you back, and then we get you down to the office and explain to you what the Apprise program is and what it does, give you a little bit of background information on it, talk about the different opportunities that are available to volunteer at. So it's a big, and then there's training that goes involved. We have online modular trainings, we have in classroom trainings as well, and you can then become a certified Apprise counselor and do what I do as well. Or you could be like someone who does like data entry, or you could be someone who does like follow-up phone calls, because we like to call our consumers back after the appointment to make sure they received what they got when they came to the appointment. So that happens not all the time, but sometimes, and we're looking for folks to be able to help us out with that process as well. So there's a lot of different volunteer opportunities available. And
So even if I'm not going to be comfortable working with someone and trying to steer them with coverage, you've got a place for me, don't you?
Exactly. Right. Yes. Yes. So that's not.
I can file.
That's not an excuse.
I can file. I can make phone calls.
Right.
I can talk, as we know.
Because we have folks that say, you know what, that looks kind of scary. I don't know if I want to do that. But we provide a very, very good training program and help folks out, and we're a support system. Like if we don't know something about a question or issue, we have folks that we can contact as well at our state office to help us navigate the issue. So we have folks that reach out too.
So you're going to make sure when you sit down with someone, you look at everything.
Exactly.
You have all the bases covered.
Right. We look at their health, their income, their medications, the doctors that they go see. We make sure that the doctors that they currently see will take the plan that they want to enroll into. And sometimes we'll have to call the doctor's office. We'll call them right now on the phone and ask them, will they take this plan next year, and get the answer right now. So we really work closely. Want to make sure that no one has an issue, that they're in the right plan, the best plan that they could possibly be in, based on what they're telling us and what they need and what they can afford to pay. So
Benny, I also want to ask you to say I get into a plan and I sign up for a plan, and my needs change through the year, and this plan is just not working. Am I stuck with it forever?
Well, this is a time frame where you can make plan changes. This is annual open enrollment period.
Which is?
It happens once a year, October 15th to December 7th, where you can make a plan change. Those are for the Advantage plans. If you want to make a plan change, it will start January 1st, 2017. Also, the period where you can change your prescription drug plan, you can make that plan change at this time period, and it will start in January 1st, 2017. So yes, there is a open enrollment period every year, and every year those plans have to send you out a notice by September 30th about any changes that are going to be coming the following year.
Okay.
So you know if you need to make a change because those plans won't cover your drugs next year.
Right.
Or if your co-pays are going to go up and you want to get out of it because you don't think it's going to be a good fit for you, or your doctor is not going to be in that network anymore, they have to notify you by September 30th if that's going to happen for the following year.
Okay.
So.
Well, Benny, our time is getting to the end, but I know one thing I do want to stress is the fact that there is such a need for volunteers. They do a great job, and it's just as you've heard, there's so many people that have these needs and are so confused with all the paperwork and all the insurance stuff.
Right.
Like I said.
Yes.
I mean, I know. I'm there.
Yes.
I'm getting it myself. Yeah. But again, if someone is interested, Benny, to take advantage of the program or even to be a counselor, how can they get a hold of you?
They can contact me at 459-4581, and my extension is 523 at the GCAC main office. And I can help them, if they don't know where to go, they can give me a call. If they want to be a volunteer, if they want to get help with their Medicare, I can get where they live at and put them in contact with the right area and the counselor that maybe would help them based on where they live.
Great. Thank you, Benny. Thank you so much.
All right.
I appreciate you coming on the program.
Thanks for having me.
Also, viewers, they do have a website, great website. A lot of information, a lot of links, not even just on the Apprise program, but for anything else you may have any questions on. They have a Facebook page. Check them out on Facebook. GCAC does. You never know if you're going to see something posted that might concern you, interest you, or you have a neighbor
Exactly.
that would be able to
Right.
take advantage of something that you're seeing. So there's a lot of ways to find out what GCAC has going on. And Benny, thank you so much for letting us know about the Apprise program. Again, it was a pleasure having you on the program.
Thank you.
Viewers, thank you again for watching the Millcreek Government Channel. And until next time, have a wonderful day.
You're watching the Millcreek Government Channel, powered by WQLN Public Media.